if you look at the statistics nationally, we have improved in terms of the amount of blood that we are collecting. We are on about 412,000 pints against the 1%, which is about 500,000. But when you really look at the need, we should be targeting way higher percentages, approaching the 4-5%. So we still have a lot of work to do. So as a blood ambassador, one is to always try and use any opportunity to encourage people to donate blood. Secondly, is to make sure that in any conversation about health, we are talking about blood, because blood is used to manage the blood disorders and so many other clinical conditions, but it rarely gets mentioned.
Today we are here for a sickle cell disease and hemophilia conference. And the purpose of this conference really is to transform the management or the outlook of sickle cell and hemophilia in this country. Sickle cell disease has been one of the diseases which affects this region. The Nyanza regions, the regions which are around the lake, and the coastal regions where malaria is.
Sisi tumekuja hapa kama county ambazo zinaungamana katika mfumo wa EREB, yani Lake Region Economic Block. Tuko county 14 na hizi county tumepata kwamba kuna changamoto ya ugonjwa wa anemia selemundu pamoja na hemophilia. Tunaona kwamba watu wetu haswa watoto hawawezi kupita miaka 5 tangu kuzaliwa. Kwa hivyo tumefika hapa tukiwa na washikadau wote katika eneo hili la EREB kuhakikisha kwamba njia vipi tutaweza kupeana damu na pia tuweze kufanya early diagnosis ya watoto wanapozaliwa katika familia ambayo anemia selemundu imekithiri.
I am here because, like other champions for sickle cell, we represent warriors. Warriors are people who live with sickle cell and hemophilia. It's important that we recognize that this is a very unique meeting where the objects of discussion, the sickle cell warrior, the hemophilia warrior, are present with the scientists and the medics and are discussing with them. Actually, the warriors have said, nothing for us without us. And why? Because with today's advancement in medicine and in science, we can give a healthy and vibrant life to the warriors. The warriors, as you have heard, exist in 1.5% of newborns, and we're hearing of 14,000 newborns within Kisumu County each year.
And in Kenya, we have 17 regions where there is this high burden, and we've been continuously working with these counties, mostly in the western Nyanza, former Nyanza region, and the coastal region. And what some of the things we've done as a ministry is that we've done policy guidelines around these diseases so that we ensure that we have guidelines that are used by healthcare workers, so that whatever is being treated in western side is the same treatment that is being given in coastal side. Also, we realize that with sickle cell disease, it is better to catch when the infant early enough, and that for that reason we have policy guidelines for screening of infants. We are able to detect who has sickle cell disease early, so that we are able to put them into care early enough. Secondly, there is a lot of myths and misconceptions when it comes to sickle cell disease and also hemophilia. We are about to go in on a nationwide campaign to educate the public about what it is, what are the symptoms of sickle cell disease, what are the symptoms of hemophilia, so that we avoid a lot of stigma and discrimination that is coming around with these diseases.